Good morning. This is Dr. Harish NS, consultant physician, intensivist diabetologist, practicing at Shipra Health Clinic, number 1, Madalur Street, Basungudi, Bangalore. On the occasion of World Hepatitis Day, I would like to share few facts about hepatitis. Why hepatitis is important? What do you mean by hepatitis? Hepatitis is nothing but inflammation of the liver. In simple words, it is injury to the liver, which is caused by various infectious and non-infectious causes. Infectious mainly due to viruses, hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E, cytomegalovirus and others. And non-infectious is mainly because of alcohol consumption and other some drug. Coming to the symptoms of hepatitis, mainly it is your abdominal discomfort, vomiting, loose motion in case of hepatitis A, myalgia, generalized weakness. You will get jaundice. If you get jaundice, you will be passing dark yellow urine and clay colored stools. Coming to the infectious causes of hepatitis, hepatitis A virus, which is a RNA virus mainly transmitted through fecal-oral route, that is contaminated food and contaminated water. When you consume contaminated food or contaminated water which is infected with hepatitis A, it is easily transmitted. So kindly wash your hand before and after using toilet, and use always hygiene measures to cook your food, and always consume filter or good hygiene water. Coming to the hepatitis B and C, which is mainly transmitted through blood, usually we see infected blood transfusion when you take blood from non-standard blood banks where they will not screen for blood, where this infection usually transmitted, and by sharing needles or syringes from the infected hepatitis B patients, usually seen in drug peddlers where they usually share needles and syringes commonly, and some healthcare associated infection usually seen in healthcare persons where they are doing some procedures to the infected patient where they accidentally get injury with needles or knives. So these are the common causes for hepatitis B in transmission. And even it is also transmitted sexually when you have unprotected sexual contact with the hepatitis B positive patient, you will be getting infection. So to prevent, use always proper physical barrier for doing sexual activity. And hepatitis C is also transmitted similarly as I told you for hepatitis B. So hepatitis C infection will be leading to chronicity and complication. Hepatitis B and hepatitis C infections are having high mortality rate. Hence, it is always advisable to prevent and always screen for hepatitis B, even in pregnancy, because hepatitis B is transmitted from pregnant woman to the fetus. Always we will try to screen for hepatitis B infection in pregnancy. Hepatitis D, coming to the hepatitis D infection, which is not usually will be independently, it won't cause any infection. Usually it depends on hepatitis B virus infection, usually seen as a super infection for the patient who is already affected with the hepatitis B or severe form of hepatitis B whom they are infected. You can see the hepatitis D infection. Coming to the hepatitis E virus, it is also usually transmitted through fecal-oral route, usually similar to that of hepatitis A. Hepatitis A and E, there is a symptomatic treatment. Hepatitis B and C, there is a definitive treatment. And hepatitis D also there is a definitive treatment. And vaccination is available for hepatitis A and B virus prevention. So kindly take vaccine accordingly. Coming to the other causes of hepatitis, usually caused by excess consumption of alcohol. Try to avoid alcohol consumption and other medication such as paracetamol. When you take excess paracetamol and over-the-counter paracetamol, when you use in moderate or whenever it is required, if you use, that is okay. But when you use excessively, When it is not necessarily you use the paracetamol, it will may also lead to the liver injury. The complication of hepatitis: chronic hepatitis, cirrhosis of liver, and carcinoma, hepatocellular carcinoma, usually caused by hepatitis C virus infection. Cirrhosis of liver, nothing but shrinkage of your liver. It leads to lot of complication. You may have swelling of abdomen, swelling of lower limbs, and you may lose your consciousness. It should be treated in the hospital. So to prevent, and other organs also may affected because of cirrhosis of liver or hepatocellular carcinoma, and you may develop blood vomiting. All those complications are there. So hence it is advisable to prevent hepatitis complications. Whenever you detect or diagnose early, the treatment will be better. It is always advisable to take treatment from qualified or board certified doctors for your treatment. Thank you.